Hello, RDs and RDs to be. Welcome to the RD Exam Ready podcast. I'm Zak Kaesberg, your tutor, coach, and guide along the path to passing the RD exam. My biggest passion is to help RDs and RDs to be just like you to know how to effectively pass the CDR exam. And if that sounds like you, then hey, you are in the right place. Formative, summative, impact, process. Four words that are associated with community nutrition programs. And hopefully, those four words you've heard before. If you haven't, you're totally okay. I'm glad you're here. In 2027, we're seeing a big shift in the exam breakdown to be a bit more focused on community nutrition. Formative, summative, impact, and process are types of evaluations that can be used for community nutrition programs. Questions that are going to be on the exam could lead you down a prompt or a situation in which you may have to identify which evaluation fits with the question. This can be a challenging process because you sometimes have to decide if the question is pointing towards the process itself, the structure, the financials behind it, or just the materials itself. Like I said, at times it can be challenging. What we're going to do today is talk through these different types of evaluations, talk about the main differences between them, and make sure you know how to apply it to some practice questions. Formative evaluations are formed throughout the design process. This is what makes it unique to other processes. You see, a formative evaluation is quite helpful for testing and assessing certain elements of your nutrition program before it's fully implemented. Here's an example. A dietitian is designing a postpartum weight loss community nutrition program. They conduct focus group sessions early in the design process and conduct testing of the program's instructional materials. The dietitian would ask that focus and that clarity of the message, the materials, and ensuring that they are meeting the reading level of the attended population. So when they're using this formative evaluation, they're able to more tailor and change their learning materials while they implement the program instead of doing it after the program is over, in which you wouldn't be able to make much impact. What makes formative so distinct is that it's forming as the program goes. The best benefit of a formative evaluation is that you get to change and improve the program delivery before and as it starts instead of waiting to the end, like I said. The end would be looking at our next type of evaluation, which is called a summative evaluation. Summative evaluations are not conducted in the beginning or during the implementation process of the program. It is conducted exclusively at the end of the program. Its main goal is to help to determine whether your program was effective and how it may be improved for future implementations. When I think of summative, I think of success. Was your program successful at achieving its goals and objectives? Summative evaluations are also known as outcome evaluations. They are the same thing per the text. Summative evaluations can also assess changes in knowledge, attitudes, motivation, skills, and behavior. If these things are outlined as objectives of your program, then they can assess if it was successful. A dietitian could use surveys, focus groups, or interviews, or even assessment data to track changes from start to finish to see if the program was successful in making notes of ways to improve the program and its effectiveness. To help understand some of the evaluations, I want to give you some examples. If a question is asking about summative evaluations, and if they are done and it asks in the question, are they done at the beginning or the end of the program? What would you say? Well, you'd have to say that they are conducted at the end of the program, right? Summative means you add everything up and review it at the end of the program. Let's say you're doing carb counting program with an obese diabetic patient. While on carb counting, let's say they end up losing body fat. Well, that's great. Was it the goal of the program, though? No, not necessarily. It was to educate them on proper carb counting and blood sugar balance, but they ended up losing body fat anyway. This is a good example of an outcome evaluation. It measures the program's effectiveness at changing aspects of health and nutrition. So, an outcome evaluation would look at things like their mortality, morbidity, health status, lab data, or risk for disease to see kind of its effect. Outcome, aka summative evaluations, as you can tell, are very closely tied to the program's accomplishments and long term effectiveness in terms of healthcare and change in a target population. All in all, summative are done at the end of the program, and they're looking at the goals and objectives of the program. This is different than an impact evaluation slightly. Impact evaluations determines if the activities that were conducted led to a desired immediate short-term change in the client. An impact evaluation is exploring if a service met the objectives that were set before the program was initiated. It looks at the effect of a service on a target population. Let's use breastfeeding as an example. If your program has the goal of increasing breastfeeding knowledge for new mothers, your impact evaluation would be looking at the knowledge of the benefits of breastfeeding, and your target population would be those new mothers. Your evaluation would assess the participants on if they had learned the key benefits of breastfeeding and whether they can describe the process of handling breast milk safety. These are kind of what you're seeing as your impact, these short term changes. You see how all these were short term? We could evaluate these kind of participants by quizzing them on if they can list the key benefits of breastfeeding and conduct the safety steps of handling breastfeeding. Impact evaluations might examine goals and objectives, or it might be things such as beliefs, self esteem, knowledge, or skill. Summative evaluations and impact evaluations are similar in that they both are associated with the program's goals and objectives. But the impact evaluation looks at more of those short term demonstrations of improvements, such as the knowledge or increase in skill, whereas summative is looking more at the long term health status, long term effects as a result of the activities themselves. Was the service successful? Process evaluations look at the process of the program itself with the goal to help make decisions about what service to provide and how to provide it. It examines the program activities in terms of things such as demographics like age, sex, occupation. It looks at the affiliated organization of the program, such as if WIC is sponsoring a food distribution system. It could look at things like funding, staffing of the program, as well as the time, location, and modality of delivering the service. In the case of process evaluations, we're looking at the activities rather than the outcome of the program. The types of questions a process evaluation could answer is, was the program properly administrated by staff? If not, why? Were participants compliant with the program procedures they were supposed to follow? Did the participants understand the program? Did some participants understand the program better than others? Why was this? As I said, we're looking at the service itself and how it was delivered. To help answer many of these questions that I mentioned, the program evaluation can use data acquired from participants to help make decisions about what to continue with or manipulate for the service. Surveys administered to the participants could help answer questions about the effectiveness of the program itself and what the barriers were to those that did not comply with the program or service. That could be things like difficulty understanding charts, or even things as funny as like finding parking to come to the service. This evaluation could be tied to things like process objectives. If a process objective has the objective of the administrators themselves. So, for instance, it could be to provide 6 sessions of carb counting for pre diabetic patients over 12 weeks. That could be your process objective. And then the process evaluation could look to see, did we meet and did we fulfill those specific objectives that we set? All in all, process objectives are going to be looking at the process of the service itself, not the outcome. These last two I'm going to talk about briefly. They are not specifically mentioned in the CDR outline, but they're located in the textbook with all the rest of these. I felt it relevant to mention it. Structure evaluations should not be mixed up with a process evaluation. A structure evaluation determines whether the steps and resources needed to deliver the program were adequate, including things like the facility, the materials, the personnel, and the equipment that was used. It would be tied to more things like structure evaluations or structure objectives, which could help provide targets and regulate resources needed to deliver the program. It seems to me that a structure evaluation really looks at structure objectives that help serve as internal guides when it comes to things like spending, use of storage, use of equipment, use of computers. Essentially, a structure evaluation is just saying, how are we going to use the resources for this program that we have? And the final evaluation I'll touch on is going to be fiscal, also known as efficiency evaluations. This evaluation is just coming down to the benefits of the program compared to the cost of the program. We've talked about before cost benefit versus cost effectiveness analysis. So, fiscal evaluation would look at things like your cost benefit analysis and determine if the program saves money or reduces costs. Let's say for every $1,000 that we spend on a patient to go through diabetes education, we save $4,000 in medical costs. So our cost benefit analysis would give us a ratio of $1,000, the cost of the benefit, the cost of the program, compared to $4,000, the benefit that we save. So these types of evaluations can be helpful just to look at the cost benefit to say, how much money are we getting back at this? You could also look at a cost effectiveness analysis, which is different than that of a cost benefit, because cost effectiveness is not just looking at fiscal or monetary units. Cost effectiveness analysis would look at the cost of the resources going in and whether that amount of money is effective in reaching the program's goals. So it might look at something such as what the cost effectiveness is of doing diabetes education remotely versus in person. Are we efficiently using the money that we're allotting for this program or service? Now let's apply what we learned today with 3 practice questions. Number 1, a food service manager who is running a Meals on Wheels congregate meal program wants to conduct a summative evaluation for the program. Which of the following is related to a summative evaluation? A, they are conducted at the beginning of the program. B, they assess the cost effectiveness of the program. C, they explore the use of resources to conduct the program. Or D, they assess whether the program met its goals and objectives. Food service manager is running a Meals on Wheels congregate meal program, wants to conduct a summative evaluation for the program. Which of the following is related? Let's use process of elimination to get us down to a couple good answers and then choose our best one. For A, they are conducted at the beginning of the program. Is that true about summative evaluations? I don't believe it is. It won't be conducted during or even at the beginning. It's going to be conducted at the end. So I know A is not a good answer automatically based on that. They assess the cost effectiveness of the program. No, not necessarily. It didn't look at such things as the cost, rather, it was more those long term effects and whether we met the goals and objectives. B is not going to be a good answer. It explores the use of resources to conduct the program. I don't think this would be it either, because this would probably be more of a structure evaluation or maybe even a process evaluation if we were looking at the activities themselves. D, they assess whether the program met its goals and objectives. This feels like my best answer for a summative evaluation because it's saying at the end of the program, did we meet our goals and objectives? And did we have a long term health effect? If I was looking at number 1, I would say D is going to be my best answer. Number 2, a dietitian wants to pilot materials while conducting a program to provide them with the opportunity to change or manipulate the teaching style as needed. Which type of evaluation would allow for this? A, process evaluation. B, formative evaluation. C, summative evaluation. Or D, outcome evaluation. A dietitian wants to pilot or test out the materials while conducting a program to provide them with an opportunity to change or manipulate the teaching style as needed. Which evaluation type would allow for this? For A, a process evaluation. Well, a process evaluation is kind of looking at the materials themselves. It is something we could change to see if we need to manipulate it, but I don't think the process evaluation is going to really help with piloting the materials. I'm going to hold on to that and just put a question mark. B, formative evaluation. Okay, so formative is done during the program itself. I think this might be a good answer because if we're going to pilot the materials and then provide them with an opportunity to change or manipulate the teaching style, a formative evaluation would allow you to do this. I'm going to hold on to that answer. C, summative evaluation. This is going to be done at the end of the program, and I don't think it's going to be a good fit because we can see if we met the goals and objectives. However, if we want to pilot the materials, this isn't going to be a good fit. Or D, outcome evaluation. Well, an outcome evaluation is the exact same thing as a summative evaluation, so I'm going to rule out answer C and D. Between answer A, the process, or B, the formative, I would go with B. Formative evaluation. If a dietitian wants to pilot the materials while conducting a program to provide them with an opportunity to change or manipulate the teaching style as needed, the formative would be good because then you could elicit feedback from the participants as the program goes along and you can make changes if they need to be made. To me, my best answer for number 2 is answer B, formative evaluation. Number 3, a hospital manager is determining if the labor spent conducting a nutrition focused physical exam leads to a higher reimbursement cost from insurance companies. The manager should conduct a blank evaluation to determine this. A, impact evaluation. B, formative evaluation. C, structural evaluation. Or D, fiscal evaluation. A hospital manager is determining if the labor spent conducting a nutrition focused physical exam leads to a higher reimbursement cost from insurance companies. The manager should conduct a blank evaluation to determine this. For A, the impact evaluation, well, that would be focused on the goals and objectives of the program and kind of those short term gains and demonstrations, like improvements in behavior, skill, knowledge. And it doesn't seem like it's going to be focused so much on the cost of the program. So I would rule out answer A. B, formative evaluation. Well, the formative is going to allow you to make changes during and kind of see how we're tracking along. However, I don't think it's going to be what you would use to determine if it's going to lead to higher reimbursement costs. It's not really money focused, so I would get rid of B. C, structure evaluation. So, structure evaluation is saying about the resources we put into the program. Could be things like money, it could be things like computers or different facilities used. I don't know if the structure evaluation would necessarily tell us, though, if we're getting more reimbursement from insurance as a result. I'd say it's more looking at what are the resources we're using to run the program. Maybe I'll put a question mark by C. And D, fiscal evaluation. I would say this is our best fit because a fiscal evaluation would allow you to look at things like a cost benefit analysis or a cost effectiveness analysis to know exactly how much you're spending and how much you're getting back when it comes to this. So I would say our best answer is going to be answer D, a fiscal evaluation. That wraps up today's lesson, students. I hope you watched, listened, learned, and enjoyed today's show. Remember that passing this exam is a journey. We all need assistance along the way. Do me a favor, hit the subscribe button if you haven't. Tell your other studying friends and students. Rate, review, comment, spread the word. And remember, as always, happy studying to you, RD2B.